Men, have you had a checkup lately? And what should you be tested for today for being proactive and preventive? Too many men suffer from andropause, low T, with cardiorenal problems, mood disorders and depression, low energy and reduced productivity. Atherosclerosis, coronary artery diseases, heart attacks, autoimmune self-attack, kidney, liver, and immune defense and repair issues are growing rapidly today, especially in younger men. In fact, I saw a report that over the next just generation, the cost of care for men with heart problems is going to more than double. As my grandmother used to say, the rents are coming up and the ceilings are coming down. Today, there are newly identified chemicals that are pervasive in our environment and are associated with this accelerated problems in men and in people in general, but especially we're talking today about men. This includes PFAS and glyphosate and microplastic and solvent residues, toxic metals, mold products, and isotopes. You can, following our guidance, reduce by 80% your exposure and then support your liver and organs to detoxify the rest. So what do I mean by primary proactive prevention? For starters, let's look at some of the key tests that are called predictive biomarkers of health and well-being. These predictive biomarkers are personalized and cover all of what's called epigenetics, meaning your health does not depend on your genes. Your health depends on your habits of daily living. In fact, 92% of your lifetime health is determined by your lifestyle choices, by your epigenetics. This is proactive primary prevention in practice and ready for you today. What tests do I include in my modern checkup? A hemoglobin A1C, which checks blood sugar and insulin over the last several months, and the goal value is 5%. I'm glad to tell you that in the dozen or more years since I lost weight, my hemoglobin A1C every 6 months has been checked, and it's 5%. HSCRP, high sensitivity C-reactive protein, measures inflammation repair deficit with a goal value of 0.5. Most of us are not repairing efficiently and suffer from some degree of inflammation as measured by the HSCRP. A plasma homocysteine properly done should be less than 6. This checks methylation balance, and Kilmer-McCulley has been showing us for 50 or more years how this affects your risk of atherosclerosis, coronary artery disease, heart attack, strokes, and actually it's now homocysteine is considered an all-cause morbidity mortality marker. The lymphocyte response assay, an ex vivo cell culture to test for immune tolerance or intolerance. Reactivity means burdening the immune system to do more defense work. The goal is tolerance, no immune burdens. We recommend today that you measure your vitamin D. It's a neurohormone. Drops under the tongue achieve the goal value of 50 to 80. Very often the intestines do not take vitamin D up very well, and so drops under the tongue before swallowing is our recommendation for achieving a healthy, low risk, lower your risk of cancer, heart disease, autoimmune disease, and chronic illness by having a healthy vitamin D neurohormone level. Omega-3 index checks the balance of omega-3 to 6. The goal is more than 8. Most of us take in too much omega-6 from processed foods and too little omega-3. So we generally recommend 3 grams or more of distilled under nitrogen omega-3 EPA DHA. And I'll talk a little bit more about that in a few minutes. There's also a test in the urine for DNA damage and oxidation. The goal is less than 5. The 8-hydroxydesoxyguanine test is the measure. And if you have enough of the antioxidants, buffering minerals, essential cofactors, and the like, that will help protect your DNA. And the DNA has many mechanisms for protecting itself if it has the essential nutrients that you must take in from the outside that you cannot make on the inside. And the last is a first morning urine pH measurement, because after rest, the urine reflects magnesium needs and excess acid called metabolic acidosis. And you adjust the magnesium choline citrate intake based on urine pH. It should be 6.5 to 7.5. If it's below 6.5, you take an extra dose per half pH unit. And if it's above 7.5 consistently, that might be catabolic stress-related illness, and we know how to deal with that. Get tested now. Correct testing, predictive, proactive testing allows you to go from no to knowing. Men are at risk of cardiovascular diseases. Dr. Paul Dudley White taught me in the 1960s that in just 2 generations, heart attacks and cardiovascular atherosclerosis had gone from very rare, like if they had 1 case a year at Mass General of a heart attack, they would publish the case because it was so rare, to the leading cause of mortality and suffering morbidity in the Western world. This is due to lifestyle changes. Men today are at increased risk of heart attacks, clots, strokes, neurodegeneration, Alzheimer's, senility. High blood pressure is all too common in at least half of older men. Indeed, medicines to lower blood pressure are effective. This is helpful. And they often do not achieve the healthy 120/80 level that we would like. But following our lifestyle advice, and you can likely achieve a healthy blood pressure, a healthy blood fats, healthy cholesterol, and blood lipids. Testosterone levels are important to measure. There's good testosterone and bad testosterone, and you should have more of the good and less of the bad. And their biorhythms influence cardiovascular repair and health, among other beneficial activities. Yes, family history does matter, such as, do you smoke? Do you get exposed to air pollution? Do you have excess alcohol intake and toxins from beverages in plastic and convenient forms? Poor dietary habits elevate risks based on how much ultra-processed items you consume. Beverages and personal care items are poorly regulated, allowing many toxins to creep in. We have put out a blog on safer personal care, and I would suggest that you take a look at drrusselljaffe.com for guidance about safer beverages. Stress management is very important, and it's needed more today than ever. More than 6 million men show signs of depression and mood disorders. They are 4 times more likely than women to commit suicide. Most people today need more of nature's ascorbate, more magnesium and choline citrate, more polyphenolics like quercetin dihydrate and soluble OPC, and the full family of carotenoids. Yes, we need beta carotene, but we need the full family of carotenoids to get the full benefit. And then we probably need micellized CoQ10 and omega-3 distilled under nitrogen to remove impurities. You may have heard that fish oils are contaminated. We have been using for decades a fish oil distilled under nitrogen to remove the schmutz, to remove the contaminants, to concentrate the EPA DHA, and in fact, we can now say that we are fish antigen free in our EPA DHA oil. We do not recommend statins, as there are safer, more helpful, natural ways to manage cholesterol and blood lipids. Prostate and testicular health is important. Benign prostatic hypertrophy, the gland growing to the point where it obstructs the flow of urine and causes you to urinate every couple of hours at night. Prostatitis, which my dad had because he spent too much time in his car sitting and not enough time peeing. Prostatitis is inflammation due to repair deficit, sometimes bacterial, but when you hydrate well, when you have enough of nature's antioxidants, buffering minerals, and essential elements, the body can usually clear that prostatitis and repair the prostate gland. Now, prostate and testicular cancer occurs in people who lack essential nutrients and have too much anti-nutrient intake. They tend to be a little bit dehydrated, and they are taking in far too much microplastic, hormone disruptors, and solvents from convenient containers that contribute risks without benefit. We recommend PERC Prostate Vitality Guard because it is a synergistic formula including saw palmetto, stinging nettle, Urtica dioica, and Pygeum africanum in their most bioavailable active form, as well as nutrients like zinc, selenomethionine for selenium, and lycopene, but the active free lycopene, and not the lycopene that's just a red color. Each is known to help. We have demonstrated the synergy for many, many years, and I urge you to test for yourself the improvement in prostate function that comes with PERC Prostate Vitality Guard. This also balances out testosterone, naturally modulating hormone levels. This enhances kidney and bladder function, noticeable improvement in nighttime frequency. Active synergistic ingredients are clinically proven over decades to be beneficial. Epididymitis is an inflammation of the coiled tube at the back of the testicles that stores and carries sperm. Testicular torsion occurs. It's a medical emergency where the spermatic cord twists and you get a very distinctive kind of pain, and you need to go to the emergency room immediately because this is cutting off the blood supply to the testicle. Solutions and preventive measures include regular comprehensive medical checkups, and we recommend biannual visits. You might want to have a sperm sample checked from time to time and have occult blood testing for early colon cancer risk every few years. Break taboos. We encourage open discussions about health issues to combat any reticence or stigma. Nature's Pharmacy provides lifetime health. In regard to diet, eating whole and hydrating often is fundamental to preventing numerous health issues. Our digestive quintet restores your microbiome, your digestion, your metabolism, and detoxification, and renews your collagen connective tissue infrastructure. Use this digestive quintet to be done with maldigestion, dysbiosis, enteropathy, dyspepsia, GERD, and parasites. The good news is that there is enough healthier, complete digestive support that replaces pathogens and promotes a healthy microbiome. In essence, Dr. Dennis Burkitt pointed out many decades ago, and has been reproven since, that good crowds out bad, that taking in enough of the prebiotic fiber, probiotic organisms, symbiotic recycled glutamine, along with digestive aid and L-histidine for stomach digestion, brings about better health. Exercise, including stretching, abdominal breathing, and movement. Walking is a good choice. Walking for 20 minutes twice a day actually moves fluids so that they can begin to bring the nutrients to all the cells that need them and take away wastes. You might want to look at our shorts and reels on YouTube channel Dr. Russell Jaffe and our IG recordings as well. Restorative sleep is most important. Restorative sleep reduces stress, improves renewal, and banishes cancer cells. We suggest keeping your bedroom dark, cool, using natural fibers for bedclothes, and turning Wi-Fi off at night. PERC Sleep Guard allows enhanced uptake tryptophan to be metabolized to serotonin and melatonin where and when needed. We do not recommend giving downstream serotonin and melatonin as they cause feedback inhibition and dependency. But PERC Sleep Guard is nature's answer to getting healthy tryptophan where it's needed to make serotonin and melatonin when they're needed. Remember biological detoxification. Safer support for your liver and all organs. The acronym we go by is GGOBE, which means enhance as staples in your diet garlic, ginger, red onions and shallots, brassica, broccoli, sprouts, and quail or duck eggs. Check your digestive transit time, your hydration status, your urine pH after rest, and how much ascorbate you need to cleanse. Follow nature's pharmacy principles for a guided approach to healthier living at all and any age. PERC LivaGuard is often helpful, as is our triple detoxifier PERC Detoxin Guard, to unburden your liver from the high-tech stress and toxins of today so that it can do its job of cleaning and cleansing and renewing and repairing all of you. Ask your healthcare practitioner how you can get these high-quality supplements. Safer, more bioactive supplements include our PERC LifeGuard Super Multi-Active Tabs Fuels. We had to develop a novel delivery system to provide comprehensive nutrient support. It combines 40 vitamins, minerals, and energizers in a potent blend. A double-blind placebo-controlled trial confirmed full uptake of nutrients. Cardiovascular and cellular health today mean meeting 21st century needs. This has been designed to reduce cardiovascular risks and more comprehensively support cell function. Be informed, be inspired, take action. Take safer supplements for life, and the repair from the past will occur. PERC sets a standard of quality that is unprecedented, partly because we and our families and team members and loved ones take these, but also because we wanted to show that in the 21st century, you needed more potent supplements, more bioavailable, safer supplements, and these are available to you now. Check out our books from HSC Press. These are available on Amazon in print, Kindle, and audio versions. Thriving in the 21st Century is our book. Natural Bone Health, A Practitioner's Guide to Healthy Bones, Joints, and Muscles is another second book, and The Joy in Living the Alkaline Way is a guide to healthful living, to having a healthy health span more than an enduring lifespan. You deserve to be thriving today, not just surviving. Join us in choosing daily health habits. We are continuously meant to renew when we have enough of all essential nutrients. Did you know that the oldest part of your body is your bones, and they're about 10 years old? They get renewed over 10 years. So osteopenia and osteoporosis, sarcopenia is not necessary. It's a product of lifestyle choices. So follow Nature's Alkaline Way and Nature's Pharmacy. Information and inspiration is available along with recipes that are all sugar-free, fat-free, gluten, grain-free, and yummy, tested in the kitchen and easy for you to improve your health, vitality, and digestion. Find lab tests and personalized interpretations on betterlabtestnow.com. BetterLabTestNow.com is a portal for consumers to get access to meaningful lab tests and interpretations of what these tests mean in the 21st century. I'm Dr. J, on behalf of Nature's Alkaline Way and Nature's Pharmacy, and I want you to feel and function as well as I do now and for a lifetime.